Hi guys, it's Angela, the baby nurse. I want to talk about what happens when you're in labor. If you stay in the hospital, it's because your forefingers open or more, or the baby's heart tracing doesn't look as well as we'd like it to. Normal heart range is usually 110 to 160. We look for good oxygenation. By looking at the baby's heart rate, we want it between 110 and 160, and we want to see the baby be a little active with the heart rate kind of going up in a little hill. That means your baby's going to tolerate light labor well. Sometimes the baby may get a little sleepy, so we may put oxygen on you. It doesn't mean your baby's really sick, so don't panic if the nurse puts oxygen on you. When you're in bed, please do not lie on your back. Babies get a little less oxygen. So tilt it towards your right, left side, whatever one's more comfortable for you. Sometimes babies have a preference, so we might tilt you to certain sides. If the heart rate goes down, which what we call a deceleration, okay, below 110, we may come in there, don't panic, but sometimes we'll even put you on all fours, kind of like a little doggy style position. That actually helps relieve pressure if the baby's leaning on an umbilical cord. Sometimes, if your water's broken, we'll put a tube on the inside to start an amnio infusion. What an amnio infusion is if the water's broken, we put water in, and the water may alleviate and take away some of the pressure if the baby's leaning on an umbilical cord. Or if the fluid level's low, it'll help add a little bit in. Now, you won't be allowed to get up and go to the bathroom if your water's broken or if you have an epidural. If you have an epidural, you're gonna probably have to get a Foley catheter to collect your urine. Most people can't urinate when they get an epidural. Now, sometimes the baby's heart rate may go low. Please don't panic. Just follow the nurse's direction or the doctor's direction. Breathe in the oxygen if we put it on you. Sometimes we'll even go in and put you on all fours, because that'll relieve the pressure off the baby's umbilical cord if the baby's leaning on it or if it's wrapped around the baby's neck. This does not mean you need a C-section. You can probably still go through a normal vaginal delivery, but sometimes we'll make you take a little break from the contraction. We may give you a shot of something called terbutaline to help kind of slow the contractions down, because if you're contracting too much, what'll happen is the baby gets tired and the heart rate may go down. So we want to give the baby a little break. Labor is exhausting. It's exhausting for the mother and it's exhausting for the baby. So don't panic. Just follow directions and try to breathe. It's very important, okay? Now, the closer you get to labor, if you have an epidural, you're going to feel a lot of rectal pressure, okay? Epidural works to help take the contraction pain away, but it usually doesn't work for the pressure feeling. But it's not as bad as the contractions, the pressure feeling. So what you're going to do is they might sit you all the way up to bring the baby's head down. Gravity, let that baby's head come down. The lower the head comes on its own, the less pushing you'll have to do when you're fully dilated. When you're fully dilated, 10 centimeters, 10 fingers open, the baby's head may still be high up. So just because they tell you you're fully dilated or 10 fingers open, it does not mean the baby's going to come sliding out right away. What it means is you probably have another 1 to even 4 more hours of being pregnant. A first-time mom can push up to 3 to 4 hours. A mom that's been through it more than once usually pushes between 1 and 2 hours. Sometimes if the baby's heart rate is going down while pushing, sometimes what they'll do is they'll tell you, we'll push every other contraction to allow the baby to get a break. It'll allow the baby to breathe in, because every time you have that contraction, it's closing off those blood vessels to the baby. That's giving the baby oxygen. So if they're back to back, the baby's not getting relief and not getting any time to breathe in that oxygen. So every other contraction you'll push, or sometimes every 2 to 3 contractions you'll push. So you have one, skip the next, push the other one. Some doctors may say, let's do a C-section. The baby's not tolerating the tracing, not tolerating the pushing. Okay? In that case, if that happens, ask the doctor, is it possible that maybe you can do like I just spoke about? Skip every other contraction and push with every other contraction to give the baby the break. Or sometimes you can ask if maybe you can take a 30-minute to 1-hour break from pushing to allow the baby to recover. Some doctors want to jump into a C-section right away, but you have a right as a patient to say, listen, can I please try this? And depending on the baby's heart rate, they may allow you to do it. I've seen numerous babies born very healthy that they were having decreases in the heart rate. But again, you need to look at the tracing. Now, the next time that I come on, I'm going to discuss and go through kind of what we look for in a tracing, so you kind of understand what we're reading when we look at the baby's heart rate. Also, I just want to mention, because I forgot before about epidurals, sometimes the epidural can make your blood pressure go very low. If your blood pressure is very low, that could also be another cause of the baby having a decrease in the heart rate. So they may give you a fluid bolus to make the water go in your IV site very fast, okay? Before you get an epidural, make sure you at least get 1 bag of fluid, of water going into your blood, because that'll help prevent the blood pressure going too low for you. Mommy's low blood pressure means the baby could have a decrease in heart rate, and something so simple as hydration can prevent that from happening. If you like my channel, please subscribe. I apologize, I'm not the best at this, but I wanted to give it a try. Many of my patients tell me that I explain things very well and I should do a teaching class. So I figured doing this might be a good way to do it. All right, so next time I'm going to discuss breastfeeding, and also I want to discuss the fetal heart rate tracings. Okay, have a great day, guys. Bye.